cancer. The very word strikes fear into our hearts, conjuring images of suffering and loss. For decades, this relentless disease has cast a long shadow over countless lives. But in the face of this formidable foe, a new dawn is breaking. Scientists and researchers are making remarkable strides in the fight against cancer, developing groundbreaking treatments that offer renewed hope to patients worldwide. Among these advancements, immunotherapy stands out as a beacon of promise, harnessing the body's own immune system to combat this deadly disease. In the realm of head and neck cancers, a particularly aggressive and challenging form of the disease, a new treatment involving the immunotherapy drug Pembrolizumab has emerged as a potential game-changer. This innovative approach, combined with standard care, has shown remarkable results in clinical trials, significantly prolonging the lives of patients. The groundbreaking findings of a recent Phase 3 clinical trial have sent ripples of excitement through the medical community and offered a renewed sense of optimism to patients and their families. The results of this trial have been nothing short of extraordinary, demonstrating the potential of Pembrolizumab to transform the treatment landscape for head and neck cancers. Head and neck cancers encompass a group of cancers that develop in the moist mucosal linings of the head and neck region. These cancers can affect various sites, including the oral cavity, pharynx, larynx, nasal cavity, and salivary glands. Risk factors for head and neck cancers include tobacco use, alcohol consumption, human papillomavirus infection, and exposure to certain environmental carcinogens. Traditional treatment approaches for head and neck cancers often involve a combination of surgery, radiation therapy, and chemotherapy. While these treatments can be effective in some cases, they often come with significant side effects that can severely impact a patient's quality of life. Moreover, a significant proportion of patients experience disease recurrence, highlighting the urgent need for more effective treatment options. The emergence of immunotherapy has opened up new avenues for treating head and neck cancers, offering a ray of hope to patients who have exhausted conventional treatment options or are ineligible for these therapies. Immunotherapy works by stimulating the body's immune system to recognize and attack cancer cells, providing a more targeted and potentially less toxic approach to cancer treatment. Immunotherapy represents a paradigm shift in cancer treatment, moving away from directly targeting cancer cells to harnessing the power of the body's own immune system to fight the disease. Our immune system is a complex network of cells, tissues, and organs that work together to protect us from foreign invaders, such as bacteria, viruses, and parasites. One of the key players in our immune system is a type of white blood cell called a T cell. T cells are responsible for recognizing and destroying infected or abnormal cells, including cancer cells. However, cancer cells are often able to evade detection by the immune system, effectively hiding in plain sight. Immunotherapy drugs, such as Pembrolizumab, work by removing the brakes that prevent T cells from recognizing and attacking cancer cells. By unleashing the full potential of the immune system, these drugs empower the body to mount a more effective and sustained attack against cancer. Pembrolizumab belongs to a class of immunotherapy drugs known as immune checkpoint inhibitors. These drugs target specific proteins found on the surface of T cells such as PD-1 or programmed cell death protein 1. PD-1 acts as a checkpoint, preventing T cells from attacking other cells in the body, including healthy cells. Cancer cells often exploit the PD-1 pathway to evade immune detection. They express a protein called PDL1, or programmed death ligand 1, that binds to PD-1 on T cells, effectively deactivating them and preventing them from mounting an immune response. Pembrolizumab works by blocking the interaction between PD-1 and PDL1, effectively releasing the brakes on the immune system and allowing T cells to recognize and attack cancer cells. This targeted approach makes Pembrolizumab a highly effective immunotherapy drug with a favorable safety profile compared to traditional chemotherapy drugs. Section 5. The landmark Phase 3 trial. The groundbreaking results of a recent Phase 3 clinical trial have catapulted Pembrolizumab into the spotlight as a potential game-changer for the treatment of head and neck cancers. The trial, known as KEYNOTE-048, involved over 880 patients with recurrent or metastatic head and neck squamous cell carcinoma, the most common type of head and neck cancer. Patients in the trial were randomly assigned to receive either Pembrolizumab alone, pembrolizumab in combination with chemotherapy, or standard care, which is chemotherapy plus cetuximab, another type of cancer drug. The trial's primary endpoint was overall survival, meaning the length of time from the start of treatment that patients lived, regardless of the cause of death. The results of the KEYNOTE-048 trial were nothing short of remarkable. Patients who received pembrolizumab alone or in combination with chemotherapy lived significantly longer than those who received standard care. The median overall survival for patients receiving pembrolizumab alone was 14.9 months, compared to 10.9 months for those receiving standard care. Section 6. A beacon of hope, extended survival. The KEYNOTE-048 trial's findings represent a major breakthrough in the treatment of head and neck cancers, offering new hope to patients who have long faced a poor prognosis. The significant improvement in overall survival observed in the pembrolizumab groups is a testament to the power of immunotherapy to transform the way we treat this devastating disease. These findings have the potential to change the standard of care for patients with recurrent or metastatic head and neck squamous cell carcinoma, providing them with a new treatment option that can significantly extend their lives. The fact that pembrolizumab was effective both alone and in combination with chemotherapy highlights its versatility and potential to benefit a wide range of patients. The impact of these findings extends beyond the realm of statistics and survival curves. For patients with head and neck cancers, these results represent precious time to spend with loved ones, pursue passions, and live life to the fullest. Section 7. Expert Opinions and Future Directions. The remarkable results of the KEYNOTE-048 trial have sent ripples of excitement through the medical community, with leading experts hailing pembrolizumab as a game-changer in the fight against head and neck cancers. Professor Kevin Harrington, a renowned oncologist specializing in head and neck cancers, has described the trial's findings as practice-changing and a major step forward in the treatment of this challenging disease. Pembrolizumab has emerged as a new standard of care for patients with recurrent or metastatic head and neck squamous cell carcinoma, says Professor Harrington. The drug's ability to significantly improve survival rates, both alone and in combination with chemotherapy, is a testament to its efficacy and potential to transform the treatment landscape for this disease. The medical community is abuzz with excitement over the potential of pembrolizumab to revolutionize the way we treat head and neck cancers. Researchers are now exploring the use of this immunotherapy drug in earlier stages of the disease, with the hope of preventing recurrence and improving long-term outcomes for patients. And Section 8, Beyond Head and Neck Cancer Broader Applications. The success of pembrolizumab in treating head and neck cancers has sparked intense interest in exploring its potential applications in other types of cancer. Clinical trials are currently underway to investigate the efficacy of pembrolizumab in a wide range of cancers, including lung cancer, melanoma, bladder cancer, and Hodgkin lymphoma. Early results from these trials have been promising, suggesting that pembrolizumab may hold promise for treating a variety of cancers. The drug's ability to unleash the power of the immune system makes it a versatile tool in the fight against cancer, with the potential to benefit patients across a wide spectrum of malignancies. The broader implications of pembrolizumab's success extend beyond the realm of individual cancer types. Its emergence as a highly effective immunotherapy drug has ignited a firestorm of research and development in the field of immuno-oncology, paving the way for the development of even more effective and targeted cancer treatments in the years to come. Section 9. A future free from fear. The development of pembrolizumab represents a paradigm shift in the way we treat cancer, offering a beacon of hope to patients who have long faced a bleak prognosis. Its ability to harness the power of the immune system to fight cancer has the potential to revolutionize the treatment landscape for a wide range of malignancies, paving the way for a future where cancer is no longer a death sentence but a manageable chronic disease. As we celebrate the remarkable advancements in cancer treatment made possible by immunotherapy drugs like pembrolizumab, we must also acknowledge the challenges that lie ahead. Further research is needed to optimize the use of these drugs, identify patients who are most likely to benefit from treatment, and develop strategies to overcome resistance mechanisms that cancer cells may develop. Despite these challenges, the future of cancer treatment is bright. With continued research and innovation, we can strive towards a day when cancer is no longer a source of fear and despair, but a manageable condition.